This is the Gambling Gauchos.
Welcome in. I am Rob Breaux alongside some West Texas bariatric superstars. We have Dr. Adam Purtell and Tiffany Willis. Almost forgot your last name. I just always call you Tiffany. Willis, you're in my phone as like TW or something, so I had to remember there.
That's right, Tiffany Willis.
Well, thank you for coming in. Off the top, I'm working with you guys, have lost some weight already in the process for several years, about to maybe get a sleeve. Not maybe, I'm going to get a sleeve.
Yes, put that mindset out there. You are going to get that done.
It's going to happen
Absolutely.
This year, but just wanted to talk to you guys about maybe the process and what you guys do and where you are and how you help the Lubbock community.
Rob, I appreciate you having us, man. So we are West Texas Bariatrics. We do weight loss surgery. And so that usually entails different variations of that surgery. But the idea is that my goal for patients is to lose weight, and I want you to keep it off long term. And if we can achieve those things, then kind of the second thing I try to achieve is that we get rid of those medical problems that are associated with people who have problems with chronic obesity. And it's a long list, but, man, I'm telling you, this surgery is fantastic as far as a health benefit. I tell people all the time, secondary to maybe people who smoke or use nicotine products, there's probably nothing better you can do for your health than losing weight and keeping it off. The problem is with weight loss, everybody tries diets. There's a lot of folks that come and see us and they say, well, I've been doing all the diets and I've done everything and I have lost weight, but it's hard for me to keep it off. And strictly with diet and exercise, it's really difficult for some patients to do that. And the surgery allows you to really have a fantastic opportunity to keep it off long term, and that's where the benefit is. As far as the process, the main thing we start with is we get everybody in. We have them come to a seminar. Those are free. We do them in our office. And the seminar is basically a way to give the information to patients, the operations we do, the benefits. We talk about the risks, and we just introduce them and try to answer any questions because there's a lot of information out there that may be accurate or inaccurate, website searches or whatever. So we try to clarify things, make it as easy as possible for people. And then following the seminar, we get them in the clinic kind of on an individual basis and go through their medical history, and we get them a plan as far as doing some procedural stuff before the operations to make sure we're safe and ready for surgery, and then get them to surgery and then start working with them on being successful. And so
you talk about like looking online, maybe like the WebMD version of what you might want to do. I did a decade of research on and off the pricing, the insurance, and I was always just scared off by the process because it seems like such a daunting task. But the free seminar really opens your eyes to exactly what's done. You go through the success rates and the issues that might you run into and some percentages. So I would encourage everyone to just, if you're even remotely thinking about it, to just go to that seminar. And I know you both spoke at them. I guess there's maybe a rotating cast of characters that is at those seminars, but
they do. That we have. Dr. Purtell has a partner, Dr. Travis Eggle, and so they rotate back and forth on opposite weeks. But yeah, we go through all of the the do's and don'ts of it all, but specifically the process of like what they want. And there's a key list of items that they want, like an EGD, blood work, psych, and dietitian. Those are the 4 non-negotiables right there. The other items that they have, they'll decide if that patient is needing those kind of things. But yeah.
Yeah, and let's, I guess, go through the process. So you go to the seminar, and then you have your first meeting with the doctor. And I guess this is just to maybe simplify the process, because I thought it was, I don't know, maybe more involved. But you guys just make it easy almost to go through, and you set you up for success.
We try to streamline as much as we can to make it easy for people. And back to your point, a lot of our patients like yourself have been thinking about this a long time, and doing your own research is not a bad thing. Don't get me wrong there. But I have patients all the time tell me I've been thinking about this for a decade, but as I also explain to them, the timing's got to be right. You got to be committed to it. It's got to be the right time in your life, whether that's, family or business or whatever. And so I think timing is always appropriate when the patient decides, okay, this is what I want to do. once we get them into the clinic, we try to make it as easy as possible. We do the EGD, which is a scope where we look in your stomach, we look in your esophagus. We do that before the operation to kind of evaluate for inflammation in the stomach. We check for what's called a hiatal hernia, which is associated with heartburn and reflux. The hiatal hernia part of it, we can fix those during the surgery if you have one. So that's why we kind of screen for that. The site consultation is kind of a standard across the country. You have to have that done mostly for insurance purposes, but when I worked in Houston, we did the same thing. We did the site consultations. Lab work's pretty basic. We'd have some labs for surgery and our nutritional markers. And then our dietitian in the office, who's really good, her name is Sarah Horn. She does a great job of kind of preparing people for what to expect from a diet perspective, both pre-op and post-op. And then she's there all along the way. So we have patients who are years out and they still come and see her, which is a huge benefit. And all that process takes about 4 to 6 weeks for most people. Now, there are some variables in there. Sometimes we have to do some extra testing, heart, lungs, various things. Sometimes we, have people lose a little weight ahead of time and things like that. But for the most part, we try to keep it simple, clean, and try to just probably the main thing is stay in communication with the patients, know where they're at in the process.
Yeah, and I think that's a key thing, too. I didn't realize, and maybe this is something special for y'all because I've really seen it and heard you commit to it, and it's one of your brands that it's a long-term weight loss. It's not just that you have the surgery and that's the last time you talk to the surgeon. It's kind of a, 6 years, 2 years? What is the relationship like in a common patient?
So as I tell my patients, I want to see you from now on, ideally. And I'm from Lubbock. My wife's from Lubbock. I'm still a pretty young guy, so I plan on working for a long time. And so as long as people are willing to come back and see me, I want them to keep coming. And the key to that is as long as you people keep coming back to see me at least once a year, I feel like we can maintain the weight loss. And sure, on occasion, we have patients who have some slip-ups now and then as they get, 5, 8 years down the road, 10 years down the road. But what the key with that is if we catch it early, we can get people back on track without having to do anything drastic. And I've had a handful of patients where we've done that, and they've had circumstances, whether it was family emergencies or what it might be, but with a little bit of weight gain. But in the short term, as long as we catch it early, we can get them back on track. And so, yeah, my purpose is one and done with the surgeries. I want to do one surgery. I want you to be successful and to keep it going.
And you talk about that and people coming in and then referring family members or referring coworkers. How important is it to just be in the community of Lubbock and even the surrounding areas? Because Lubbock is really the hub. You call it the hub city of a lot of the local places and hospitals.
It's hugely important. We have the majority of our patients that come in our door for the first time tell us, I heard about you from a coworker or a family member, or, you did my wife's surgery, that type of thing. And that's as far as practice and as surgeons and knowing what we're doing is working. That's probably the best thing that tells us, hey, this is a good thing, because people see the results and makes them excited and they want to be successful like their loved one or their friend or their coworker. And so from a bariatric practice standpoint, that's probably the most important thing.
Look, I know we're working together, but I would say this anyways. Everything I've heard about West Texas Bariatrics and you, Dr. Purtell, and Eggle, because I've had people come to me, hey, we worked with them, we had this surgery, we had that surgery, we had this. It's all been positive. Even someone who just came to the seminar and didn't get the surgery came away with something. So it's impressive, honestly, and I think that just speaks to what you guys do in the community and even your deals like the new corporate partnership with Texas Tech. It seems like you guys really get it.
Well, I appreciate that. A lot of that's our staff. They're fantastic. They take such good care of the patients. That includes both our staff at our office, our operating room crews. We use the same anesthesiologists. We use the same surgical techs and OR nurses. And all of those people are just committed to it. And it's made for such a nice running smooth system, and I think that translates into patient satisfaction and them being pleased with the outcomes.
Tiffany, you also active on social media, the West Texas Bariatrics brand.
A little.
And you also work with patients in and out, getting them organized. How would you say maybe in the last couple years has the community changed or improved? And Because it almost seems like there's not a stigma anymore around weight loss surgery.
Well, I hope there's not. I mean, I think that it's one of those things that we should all talk about. And I hope that other physicians will talk about, because I know that that's a hard area for PCPs and internal med doctors sometimes to talk about, is the weight issue. But, I think that the community has grown in the sense of opening up the idea to weight loss surgeries. Our seminars have been highly attended, even during that COVID thing. We had a lot of people show up and mask up or whatever they needed to do to, come and get the help and the information that they need. Whenever we go out to doctors' offices and we do education stuff and outreach to other outlying communities, everyone has tons of questions, and then they're like, oh, my brother's sister's cousin's having it, or had this, or a long time ago I've had this surgery. So I think everything is relatable, because weight is just such a relatable topic. And so, I hope that people are open and know that West Texas Bariatrics and Dr. Purtell and Dr. Eggle are it's like a safe tree, a safe little place for you to come, because that's the one commonality that we have when we go into that place is, and to go get the help, is that everyone's dealing with a weight issue. It's not just a cardiac issue or a bone issue, a joint issue, or anything like that. It's the weight issue, and that's what we want to help.
Yeah, and it's you mentioned the psychiatric component to it as well, and it's just for insurance, but there's also maybe even though you see other people that are overweight, there's also you kind of feel like you're alone in it.
Yeah,
and I think it's really good to find a community. You also do
support groups,
yeah, which I think is really cool.
Yeah, we have actually our support group is the third Saturday of every month at 11, and I run them, and they are fabulous. It's grown also over the last year and a half, but you're right about that weight is not. When people are overweight, we do have a stigma that we carry around with us. I've had weight loss surgery, and so I know that me going into a gym was very intimidating, even though I knew what to do, but it was still very intimidating. And so having that community and having the staff and the other people that you meet along the way really helps build your confidence about it all. And that's what's also, I think Dr. Purtell would also agree, when people have their surgery and they come back in, whether it's 2 weeks, 3 months, 6 months, or a year or further out, and we walk in and we have to reintroduce ourselves with them, because they were like, who are you? Because their confidence is high, they have a good mindset, but physically they look totally transformed. And it's so fabulous. Yeah,
and I'm early on in the process, but I've been having non-scale victories like crazy. My shirts are getting loose.
Yay, non-scale victories are fun.
My pants are in my armpits right now.
Absolutely.
Just keep pulling them up further and further.
No, it's
Belt
awesome to see
loops
that.
and all that stuff.
Yeah.
You see that progress in patients where they start doing things they've been wanting to do for a long time, whether that's something simple like going to the park with their grandkids and running around, or I had a lady that told me she went to the zoo with her kids and her grandkids. They couldn't keep up with her. She's running so fast in front of them. And before that, she was actually in a motorized cart, so she's really done tremendous. But seeing that transition is fantastic. And, I tell patients all the time, the obesity thing, a vast majority of that is, a lot of it's genetics. You inherit what you get from your parents, and we don't get to choose that. So you're fighting genetics. These Western diets that we all are participating in make it very difficult as well. But the surgery allows an opportunity to overcome all those things and have success. So that's really where I think we see the biggest benefit.
Well, and you talked about the psychological part of things, Rob. It's what I always tell the patients and is that we don't get to whatever weight we are just by giggles.
Yeah.
There's a reason why we got there, and so you have to deal with that, or you're not. I don't feel like you're going to be as successful as you could if you don't deal with that. Whether you're trying to lose 50 pounds or 500 pounds, it doesn't matter. You have to deal with that. And that, I think, because people are always like, oh, I don't want to do the psychological. Can you talk to the doctor, Tiff? And I'm like, no, I'm not going to, because you need to do it. You need to have that. And so for them to, and then afterwards, they're always like, okay, that was good. Because I'm like, it's just a good warm fuzzy for you to get whatever you have out, whatever trauma or situation you've gone through, and then their mindset is completely different.
Yeah, and that fortuitous kind of a chain of events that led me to you guys and even to the situation I'm in. I was losing weight and preparing for this even before I knew that I wanted to. And part of that was therapy. And there's a stigma around that as well. And I would tell anyone thinking about weight loss surgery or just stress, as little as that, if you think something's gone on, if you don't think something's gone on, just go see somebody about it, because as much as your physical health matters, I think emotional and mental health is all related. So.
For sure. 100% agree. 100% agree.
All right. So Dr. Purtell, let's say somebody's on the fence listening to this, maybe one piece of advice that would help them, and then the first step besides just the seminar.
If somebody's on the fence, I always like to talk with them at least and have a conversation and see, weight loss surgery is not the only option that we offer. We have diet plans. We have a dietitian. We have different diet meals that we offer. But I do specifically tell them this all the time when patients are on the fence. I said, I'm not going to do your surgery if you're on the fence. You've got to be 100% committed, because there is some lifestyle change there. And for you to be successful, I want you to be all in. And I'll be honest with you, the vast majority of patients end up there, but I'm not going to push them into it. They got to make that decision on their own for sure. But once they hit that point and they say, okay, this is what I want, we'll give you everything we got to get you to your goals. And until then, I'll keep working with you and helping you however I can. If you don't want to have the surgery, if you want to try medications, if you want to do diet and exercise plans, dietitians, we got those options too. But the biggest advice I give them is whether you have surgery, whether you just be active, try to lose the weight, try to get healthy, and I'm telling you, you'll live longer, you'll feel better, your mental health is stronger, the diabetes risk, the blood pressure risk, heart disease, stroke risk, all that stuff gets so much better if you can get that weight off and maintain the weight loss.
Man, I've lost 150 pounds, just crossed the 150-pound mark. I feel really good. I can't wait for the next 150 because I have that much to lose. But
I love it.
Really excited, and I've really enjoyed working with you all. I've been up and down. I've lost 80 pounds, I think, 2 or 3 times in my life. Always gained back even more. So it's just been not only losing it again, but keeping it off. And it's been, 2 years now that I've been going through this. So it's been a really good journey, and it just elevated once I met you guys. So it's been really cool. Tiffany, where can they find you if they have questions or maybe want to follow you guys on social media?
So you can follow us on Facebook at WestTexasBariatric.com, or that's our website. Hello. WestTexasBariatric.com is our website. And then West Texas Bariatric is our Insta and our Facebook. And then you can always just call up to the office to 806-771-2222 and ask for us. And email however you can get in touch with us. We'll be more than happy. We do, I'm the one who answers all the Facebook and Instagram questions and stuff. And so if that's an easier way, because you're still like Dr. Purtell and you were talking about with being on the fence, that's okay too. I mean, I've had a number of people on the fence and we've okay, let's just go forward. So any way we can get in touch with us, we're welcome to have you.
All right, awesome. And since we're podcasting here, you can listen to this anytime. And no matter when you listen to it, the next seminar is next Tuesday.
Every Tuesday, 6 p.m.
6 p.m.
The
address?
3611 22nd Place. And it has West Texas Bariatrics on the building, so it's very easily, readable.
It is. It's off the beaten path a little bit, too, so it's nice and easy to get to.
There we go.
Absolutely.
No traffic over there.
No traffic. Has a nice yard.
Except that 19th Street. How is that going for you? Well, I never drive over there anymore.
It's a nightmare.
It is.
I would imagine.
It never ends.
And it's not going to end very soon.
I forgot that I didn't even know that it was happening, and then I just came upon it. I was
one day.
What?
Yeah. Anyways.
Yeah.
Go love it.
Yeah.
Love this place.
Yeah.
All right. I guess that's all for me. I don't have any more questions. Do you have any final thoughts, or do you want to close with some profound statement there, Doctor?
Nothing profound. I just appreciate you having us, man.
Cool. All right. Thank you, guys.
Thanks, brother.
Thank you.